Over the past 2 decades, state and local governments have been able to secure more than $50 billion in settlement money related to the opioid epidemic in the U.S. But that money might not be going where you'd expect. Many of those settlements with major drug companies outline how the money should be used. But a new KFF Health News investigation finds that in 2024, more than $61 million was used to fund law enforcement. The CDC says more than 500,000 people died from an overdose involving opioids between 1999 and 2022. Earlier this year, all 50 states approved a $7.4 billion settlement with Purdue Pharma, the maker of OxyContin, over the company's marketing of opioids. For more, let's bring in the author of that article, Aneri Pattani. She's a senior correspondent for KFF Health News. Thank you so much for being here. So as we mentioned, there are suggested outlines as to how state and local governments should use the money from these opioid settlements. What are some of those suggested uses, and how much money is actually going toward that?
So the uses are pretty broad in the settlement. They define addiction pretty broadly and try to put different buckets of ways that the money can be spent. So things that would prevent an addiction from developing in the first place, money going towards treatment, making treatment more accessible or helping people pay for treatment, things that would help in long-term recovery like housing or getting legal aid for folks who have a record, job training. So there's a wide variety of ways that the settlement says the money can be used. And what our tracking project that we did at KFF Health News, along with partners at the Johns Hopkins Bloomberg School of Public Health and Shatterproof, what we found is that a good chunk of money is going to those sorts of things. But there is also a lot of questionable spending happening.
So in your investigation, you found drug busts, arrests, they can actually exacerbate the overdose crisis. So what did local officials tell you about why they're choosing to put the money toward law enforcement rather than those other means that you mentioned?
Yeah, so I spoke with local officials all over the country, different parts, who are putting that money towards buying tasers, buying drones, buying police cruisers, gun silencers. And what I heard was a really common theme that this is the tool that we have to address addiction, especially in rural places. A lot of folks were saying, we don't have a treatment facility, we don't run any treatment, but what we do have is a police department or a sheriff's office. And you know what? Our constituents think that those efforts are effective at treating the addiction crisis, at combating it. The problem is, as you mentioned, research does not support that. There's a lot of studies that suggest that when there are more drug busts and arrests, it deters people from calling 911, and overdose death rates actually go up.
So what are your other takeaways from this tracking project?
So in addition to the law enforcement spending, there's been a lot of interesting spending in the prevention realm, things where elected officials say, you know, we need to be investing in our children and preventing the next generation from becoming addicted, which I think is a goal that by and large everyone I've spoken with agrees with. However, how it's approached seems to vary widely, and we saw spending on public concerts, spending on sock hops where people took a pledge to remain drug-free, on an MMA exhibition, all these things that officials said, you know, would stop addictions from starting, and that a lot of researchers and experts in the public health realm are just incredibly skeptical that it's going to make a difference unless it's part of some broader initiative that addresses these topics with kids over time. These one-off events are not effective.
All right, Aneri Pattani, thank you.
Thank you.